The term biotechnology, or BioTech for short, covers a range of methods for modifying living things for human motivations. You can think of the domestication of cats and dogs as a historic form of biotech. In this video, I will use the term to focus on the modern techniques. These have the potential to change the human existence in orders of magnitude greater than any technology to date. In 1879, the light bulb was invented by Thomas Edison, and within a few years, the elites of that period began electrifying parts of their homes. By 1925, half of the homes in the US had electric power. I bring this up because over the past 100 years, we've seen electricity drive all manner of innovations more and more as the years rolled on. Now in 2022, we have things like smartphones, electric vehicles, 5G, and many other things that humans in 1925 could not have imagined. Well, just over 50 years ago from today, scientists learned how to read the DNA source code. This discovery has opened the door to understanding, modifying, and even creating the code to life. This is much in the same way that the transistor allows us to build computers of draw-dropping ability, all by controlling the flow of electricity. The biotech revolution is just starting to take off, and 100 years from now, it will likely have brought things to the world that humans today, like you and I, do not even have the capability to imagine. We've really just seen the beginning of this technology. GMOs and services like 23andMe are a few things that the discovery of DNA has allowed. However, there are two areas of biotech that have taken off in the past few years and offer much more exciting possibilities. These are CRISPR gene editing and synthetic biology. The most revolutionary technology that will drive this biotech revolution is CRISPR gene editing. It allows for the editing and replacing of gene sequences within the body. The acronym CRISPR is the name given to clusters of DNA found in organisms that are repeated in a consistent manner. This discovery was made by a research team at Osaka University in the 1980s. It was later discovered that these repeating clusters would enclose DNA that came from viruses or bacteria that had previously attacked the organism. Essentially, the CRISPR DNA segments have an immune function, allowing the organism to flag and identify DNA that is matching in the attacking virus or bacteria and deal with future attacks that have been seen by the organism before. The key piece to this virus detection system is an enzyme called Cas9. This enzyme carries a copy of the CRISPR sequence with it and acts as a police dog, so to speak, searching the body for bacteria or viruses that have matching DNA. This was the understanding of CRISPR and Cas9 until 2012. In this year, a game-changing discovery was made by two biochemists, Ms. Jennifer Doudna and Ms. Emmanuelle Carpentier. These two scientists discovered that the Cas9 enzyme could be reprogrammed to target, destroy, or replace specific genetic sequences, not just in invading viruses or bacteria, but also in the host's body itself. This was the birth of modern gene editing. In the years since 2012, a wave of research and clinical trials using CRISPR gene editing has begun. In a clinical trial by CRISPR Therapeutics and Vertex Pharmaceuticals, CRISPR was used to modify the DNA of patients with sickle cell anemia. Sickle cell is a hereditary disease that affects the shape of red blood cells and shortens lifespans to only 45 years. The trial appeared to cure sickle cell in all 31 patients that participated. It is expected to be fully approved for use in early 2023. To be clear, this one-time cure changes the patient's DNA and edits out the sickle cell gene, transforming these patients into normal humans. At this point in time, hereditary diseases of the blood, the liver, and the eye are the most immediate targets of CRISPR gene editing because these organs are easily accessible. The liver, for example, is an organ that naturally takes up molecules and thus is easy to access. After hereditary diseases are tackled in these three organs, we will see CRISPR gene editing move to more challenging organs in the body, like the brain. This will happen as more advanced delivery mechanisms are developed to get the gene editing molecules to where they need to be in the body. But these are just the short-term possibilities of CRISPR. In the medium to long term, we will see this technology being used to design babies, change one's own genes, and develop new forms of nutrient-dense food. It could even be used to build entirely new forms of life that have never existed in nature. We can basically see a world like Blade Runner on steroids. Of course, like most new technologies, these things will only be accessible to the elites at first. They may bring about incredible social tensions as the elites are able to keep themselves younger and upgrade all manner of physical and mental traits while the plebeians are left in the dust. There is another field of biotech that is also advancing at breakneck speed and will work synergistically with CRISPR gene editing. That is synthetic biology. Synthetic biology can be thought of as taking biology from its analog form and bringing it into the digital world. This is sort of like how the analog form of electricity was turned into the digital form of ones and zeros. This set a basis for the development of semiconductors. Instead of ones and zeros, the basic building blocks of synthetic biology come in two different sets. The first set consists of the 4 base pairs of DNA: adenine, thymine, cytosine, and guanine, or ATCG. The second set is formed by the building blocks of a cell, which are promoters, terminators, ribosome binding sites, and plasmids. Thinking of DNA and cells in this way is the convergence of biology, computer science, and engineering. It is only possible now because of how advanced our computers have become. It sees the building blocks of cells and DNAs as parts that can be programmed, reassembled, and standardized, much in the way that computer programming languages are developed from the building blocks of ones and zeros. Instead of modifying existing DNA, the field allows for the making of entirely new DNA code on a computer and running simulations to see what physical traits these would map to. The rise of robotics is allowing for a greater and greater portion of the lab work to be carried out through automation, instead of depending on error-prone humans to be lab rats and exposing them to hazardous chemicals. Lab work is becoming automated. The scientists and engineers in this field can focus more and more on the design work and analysis of the results. Synthetic biology allows for the quick development and testing of pharmaceuticals, gene edits, and nanoparticles. We have already seen synthetic biology impact our lives in recent years. The Moderna mRNA vaccine was designed entirely on the computer in a matter of days. The testing and manufacturing processes of the vaccine took up the vast majority of time in its production cycle. The synthetic biology company Ginkgo Bioworks is applying synthetic biology to fields like agriculture and biofuels. It can design and print DNA and contains the world's largest genetically engineered DNA strain bank. Its labs are full of robots that allow it to develop and test hypotheses at a dizzying pace. The possibilities that gene editing and bioengineering are going to bring over the next decades is unimaginable. We should expect genetic diseases to be the initial focus, which is already underway. The really interesting possibilities are if you look out a few decades. As these technologies are developed more and more, we will see them creep into the consumer and cosmetic world. Think of being able to change your face, hair, skin, and so on with some sort of genetic modification of your own DNA. These technologies will also likely offer life extension remedies. Humans are very selfish creatures. We all want to live forever and have the looks and abilities of a Superman, so to speak. Once these things become more and more possible through CRISPR and synthetic biology, the demand for them will be impossible to comprehend. Let's now take a moment to reflect. 20 years ago today, smartphones did not exist and Apple stock was trading at 25 cents per share. Today, over 80% of the people on Earth have a smartphone. The price of Apple stock has multiplied over 650 times, and Apple is now the largest company on Earth. The demand for technologies that are internal to our very selves will be on a level that is difficult to grasp. Out of all the investment ideas I'll talk about on this channel, the field of biotech has the longest time frame and can explode in growth for decades. If you look at the NASDAQ, biotech stocks currently make up less than 6% of the NASDAQ Composite Index. In the year 2050, I expect biotech to make up at least 50% of it as it grows and as the field of IT becomes more and more commoditized into everyday appliances. Let's now look at some investment ideas to take advantage of this. In terms of CRISPR gene editing, there are 5 publicly traded companies that are focused on development of this technology worth looking at. They are CRISPR Therapeutics, Aditas Medicine, Verve Therapeutics, Beam Therapeutics, and finally Intellia Therapeutics. All 5 of these stocks are down over 50% from their all-time highs put in 2021. These companies are currently focused on using CRISPR to develop gene editing mechanisms for treating hereditary diseases. With the prices that these stocks are trading at, there is the potential for some of them to be bought out by other huge biotech companies or pharmaceuticals at big premiums to what they are currently worth. For synthetic biology, the 5 purest plays of public companies at this time are Twist Bioscience Corp., Ginkgo Bioworks, Amyris, Precigen, and Codexis. These companies are all applying synthetic biology in many different avenues. Their stock prices have also been crushed from their highs of last year. With that said, the safest and probably smartest way to take advantage of the biotech revolution is to go with an ETF that holds many of the stocks that were mentioned. For an ETF that covers biotechnology in all of its various forms, IBB and XBI are the ETFs to look at. If you want an ETF that focuses more on the most cutting-edge gene editing and synthetic biology stocks, ARCG, XDNA, and Genome are the 3 ETFs that fit this bill. ARCG is by far the most liquid and popular of these 3. It is currently down about 70% from its all-time highs of early 2021.